The majority of clothes, shoes and other consumer goods found on store shelves are often put together by young women working in developing countries. For the women, the jobs provide opportunities that were not available until now. But with these opportunities also come new challenges. One initiative that is hoping to address some of these challenges is the Health Enables Returns, or HERproject. The project promotes investment by international companies in workplace programs that link women's health to business value. HERproject is led by BSR, or Business for Social Responsibility, with funding from the Swedish International Development Collaboration Agency and the Levi Strauss Foundation. Responsible Business Television first visited the project in 2008.
We found an unmet need for the millions of women working in factories exporting products around the world. These women, often aged 18 to 25, had no access to health care and no information about how to ensure their own health.
BSR found that investment in improved health education for female workers has significant business benefits. Staff turnover and absenteeism was lower, and as a result, productivity was higher. HERproject currently has over 50 completed and active factory programs impacting over 100,000 workers. HERproject continues to expand with programs in Bangladesh, China, Egypt, India, Pakistan and Vietnam.
The reason why we think this is a really important project for us is that it plays a crucial role in fulfilling the mission of BSR, which is to contribute to a just and sustainable world, working with our membership. It does so very specifically by contributing to improving the health of women factory workers.
Here in India, Columbia Sportswear, one of 12 corporate HERproject partners, has collaborated with supplier company Indian Designs in Bangalore to implement the HERproject. The project initially ran from October 2008 to March 2010, with Indian Designs choosing to continue the program for an additional year.
This program brought to them knowledge and awareness about several issues that impact their lives. Issues like sanitation, personal hygiene, reproductive health, the role of nutrition in their well-being, mental health and communicable diseases. I think this program has helped to raise the quality of their life, not just their own but in their families also.
Factory management worked closely with the HERproject team to improve overall health awareness in the factory, from food habits to family planning.
The main problem that they face is that they have a general lack of information about how to care for themselves from a health perspective. So what this means is that they have a very difficult time identifying potential health challenges when they move from rural areas where they come into industrialized areas, where they face additional risks such as sexually transmitted infections.
A health needs assessment was conducted with 150 workers from the Bangalore factory in order to determine their needs and attitudes regarding health issues.
We first do a health needs assessment of the workers and find out what their actual health needs are. So over a 2-day period, we cover about 6 topics and make sure that the workers know something about each of those and are able to communicate to their colleagues about what those health problems are.
ನಮ್ಮ ಜೀವನದಲ್ಲಿ ತುಂಬ ಬದಲಾವಣೆ ಆಗಿದೆ ಮೇಡಮ್. ಯಾಕಂದರೆ ನಾವು ಫಸ್ಟ್ ಇದ್ರ ಬಗ್ಗೆ ಏನು ತಿಳ್ಕೊಂಡಿರಲಿಲ್ಲ. ಈ ಎಜುಕೇಷನ್ ಬಗ್ಗೆ ಏನು ಗೊತ್ತಿರಲಿಲ್ಲ ನಮಗೆ. ಫಸ್ಟ್ ನಮಗೆ ಕ್ಲಾಸ್ಗಳನ್ನು ಅಟೆಂಡ್ ಮಾಡೋಕ್ಕೆ ಆಗ್ತಾ ಇರಲಿಲ್ಲ. ಇಲ್ಲಿ ಬಂದ ಮೇಲೆ ಈ ಫ್ಯಾಕ್ಟ್ರಿಯಲ್ಲಿ ನಮಗೆ ಕ್ಲಾಸ್ ತಗೊಳ್ತಾ ಇದ್ದಾರೆ. ಅದ್ರ ಬಗ್ಗೆಯಿಂದ ನಮಗೆ ಸ್ವಲ್ಪ ಹೆಲ್ಪ್ಫುಲ್ ಆಗಿದೆ. ಇವಾಗ ನೋಡಿ ಬೆಳಗ್ಗೆ ಎಕ್ಸಸೈಸ್ ಮಾಡೋಕ್ಕಾಗುತ್ತೆ. ಆಮೇಲೆ ನಾವು ಬೆಳಗ್ಗೆ ಟಿಫನ್ ಮಾಡ್ಕೊಂಡು ಬರೋಕ್ಕಾಗುತ್ತೆ. ಬದಲು ಇಲ್ಲ ಅವ್ರು ಕೇಳೋ ಪ್ರೊಡಕ್ಷನ್ ಮಾಡೋಕ್ಕಾಗುತ್ತೆ.
The peer educators trained 1,600 fellow workers in general and reproductive health from June to August 2010.
The way this program was designed, a core group was chosen. These were called the peer educators, and they in turn trained their colleagues. And this increased the level of interaction between the workers. And I think it helped in fostering team spirit between them.
A perhaps unexpected result of HERproject is a better relationship between companies of the Columbia Sportswear supply chain. In a survey of participating HERproject brands, 40% reported improved compliance among participating factories, and an additional 50% reported indirect compliance benefits from the program. In terms of business, The reduction in absenteeism as a result of HERproject has been significant. Women are better equipped to maintain their health during work and as a result avoid taking sick days. Workers now regularly approach the medical officer to ask about a range of general health and family planning concerns, knowing they will be helped.
When we interact with the factory, one of the objectives that we have is to improve the working conditions where our products are made. And this project has been very helpful in achieving that. I see there is a reduction in the absenteeism, the worker turnover, and increase in production efficiency. And this all helps in making our products better.
HERproject has proved that investing small amounts in employee welfare can bring large rewards for employers. And thanks to its peer education initiative, new workers at factories like this will continue to reap the benefits of improved health education for years to come.
Business benefit is truly centered around the perspective that healthy workers is a healthy business. And from the perspective of the suppliers, it means less days away from work. It means more productivity. It means more motivated workers. From the perspective of the multinationals, it means better relationships with their factories and suppliers, as well as their workers. It means more productive factories, and it means a contribution to addressing health issues in the communities that they work in.